LANAP has been a great practice adjunctive tool in helping patients get the care they need, because for the most part, patients aren't as scared to have a procedure done with a laser. When you talk about blades and sutures, that raises the anxiety level of quite a few patients. I do feel like it is efficacious as well. I've had a lot of success over the last 6 years using LANAP and offering it to my patients. I feel that I've helped many patients who before would have not done periosurgery move forward with care because of having this option. Implants are failing in dentistry because of the failure of diagnosis of periodontal disease and getting that treated and under control before placing these implants. I think that the rush to place an implant when a tooth is lost versus comprehensively treat the patient and deal with the disease which can inevitably take out the implant is why we're seeing so many failures. Peri-implantitis is on the rise. We jokingly in perio say patients, people think patients have a titanium deficiency, meaning that they need implants, and the reality is patients need teeth. If you can save a patient's tooth over placing an implant, in the long run, if it's functioning and it looks well, that's the best option, because teeth have periodontal ligament space, which is like little shock absorbers, compared to implants, which is almost like screwing a titanium, screw into a piece of concrete. There's no give, there's no movement. So I think saving teeth is very important, because currently we really don't know how to treat peri-implantitis consistently well. It's a 50-50 proposition. At least with lasers we've shown you can decontaminate the surface of the implant a lot better than you can mechanically, but saving the natural tooth is always better. I have a lot of great success stories with LANAP and one with LAPIP. I have a specific patient who was very against traditional periosurgery. In fact, he wanted to guarantee that if the procedure didn't work, that I would take the tooth out for free. And I felt that seemed fair. It was one of my early cases in 2013, and I said, sure, happy to treat this case where I could have done traditional bone grafting in a flap, and if LANAP fails, I'll take your tooth out for free. It seemed to be a fair proposition to me. So we did the treatment, followed the LANAP protocol, 100%. He came in every 3 months for the first year and took our follow-up x-rays at 1 year and probed, and it was pretty amazing. He went from a 9-10 millimeter pocket into the furca to 4 millimeters, and that was without a lot of recession and without sensitivity and without pain. And the patient was, of course, really pleased to have the success. In fact, he was so pleased he allowed me to publish the case in an online journal. So I feel like that's a great success story, because in dentistry, we don't sell widgets. We help our patients get healthy by techniques, and there's the other side of the equation, which is the patient's own immunity and in response to surgery. And so surgery in general can't be guaranteed, because human beings aren't robots. We're not putting a round peg in a square hole. So it's really important when you have potentially challenging cases, which are pretty much every perio case, that you're able to have successful results most of the time, even with somebody who's doubtful. So with regards to the LAPIP case, I've gone in and used the laser to treat peri-implantitis in a patient that was fearful and didn't necessarily want traditional bone grafting, and we were able to save her implants. She went from 7 and 8 millimeter pockets with bleeding and pus or purulence to 4 and 5 millimeter pockets with no bleeding, healthy tissue, able to keep it clean, and so far she's doing well. Post-op for these patients they were all very shocked and surprised at how little pain they had from the whole procedures, beginning to end. My advice, if you have a company, I guess kind of poaching the hard work and the R&D of another company that they put into developing a product and making sure that a product is used in the correct way and successful, I would be very wary of that. The reason is this. Simply put, having a bunch of dentists in a room is like having 12 cooks in the kitchen. We all want to modify things, we all want to put our own little flair on it, we all want to do it our own way, and now you have a company doing that just to make some profit. It's almost like somebody coming to your practice and you're going to give them the best care, you offer them the best treatment plan, and they take your treatment plan down the street to Discount Dental, and Discount Dental says, well, I can do that for half the price. Well, no, they really can't, because there is no such thing as a free lunch. You have lost something in that translation, either quality or time or investment in helping you grow as a clinician, and not to mention they don't have all that original research. The protocols may not be the same. Sometimes with research, a very small change on one end can make a very big difference in the results on the other. So my advice would be careful, be critical, and investigate why they think they're exactly the same when they're not exactly the same. Because again, there is no free lunch.